Hello, I'm Keeley. I'm a cuddle therapist. I want to talk a little bit about the difference between cuddle therapy and traditional talk therapy, psychotherapy, counseling. On the surface, there are definitely a lot of similarities. Both professions involve empathetic listening. Both professions can involve a lot of talking. There doesn't have to be a lot of talking in cuddle therapy, and there can. It's welcome and not required. There are also similarities in how people may feel supported. People will often feel, hopefully, they will not feel judged. They'll be in an environment of what we like to refer to as unconditional positive regard. It is a service, so it is for the purpose of someone's well-being. It is to support them. It is to help the client. So it isn't the same as a friendship or a partnership or a relationship in that way. So that's also a commonality between those two different modalities. And there are some pretty key differences. A cuddle therapist does not have the skill set, cannot diagnose anyone with a mental illness, cannot identify or diagnose their mental illnesses. They cannot treat any mental illness. One thing we can do is help with symptom relief from common conditions like depression, anxiety. We certainly can be useful for symptom relief, and we are not people who are treating any mental illnesses at all. Really important that we get clear and establish that so that people get the right kind of care when they're looking for care, when they're looking for support. There's a big difference. There is a much different protocol in terms of touch, obviously. Your therapist, your talk therapist, psychotherapist, counselor has quite a bit of ethical guidelines around how they engage with touch. They're oftentimes fairly specific. So that isn't the primary way they're going to be able to support any of their clients. With a cuddle practitioner, that is the primary way that we get to support you. Again, it is not required, just like talking. Touch, even though it's called cuddle therapy, isn't required. But it is uncharacteristically an option, uncharacteristically when we're looking at the therapies, right? Being held, getting a really long, beautiful hug, having your head in your cuddle therapist's lap and having your hair stroked. Those are all things that are absolutely on the table. We can engage in this nurturing, platonic physical comfort, and that is a huge difference. I resonate with that kind of modality, obviously, because I am one. And I resonate with the other. The way in which traditional psychotherapy, Western therapy, supports people in their pursuit for well-being, mental health, and well-being. There we go, I got it. is very cognitive. It's like in your head, you're thinking about stuff, right? And they hopefully and often therapists will bring in somatic practices or practices that involve noticing what your body is doing. Where's your breath, right? Are you feeling tense? Some mindfulness practices. Oftentimes they'll bring some of that in. I think that is important to note the direction that went, or the order of operations that went. They're in the thought space, and they can bring in elements of your body. One hallmark of cuddle therapists that is unique and sets itself apart from that style is that we almost do the exact reverse. We start in the body. What is our body doing right now? How do we notice that? How do we get in touch with what our nervous system is doing? How do we get in touch with how we feel, how our body feels about it? If there are any neuroscience geeks out there, we work a lot with the vagus nerve. We work a lot with polyvagal theory. But for anyone else who's not familiar with those things, it just means we're paying so much close attention to our body, what our body is doing first. And then from that place, we can bring in, how is that impacting our well-being? How can we then choose to impact our well-being differently than it was before? But it originates and starts in our awareness of and our relationship to our bodies. And so I think that the two professions complement each other really beautifully. And I think that when working in tandem, really powerful, really transformative things can happen for clients that change their lives. I've seen it. I've been a part of it. It's very beautiful. I think that independently, the two professions can be, in different circumstances, more right for a person, depending on their context, depending on their lived experience, their current environment, their current relationships. One might be more appropriate at some points than others. So I see the two professions as having sort of the same soul, the same heartbeat. It's all about your wellness. It's all about supporting you. It's about your well-being and how you can thrive in your life and feel fulfilled and whole and wonderful. And there's two different approaches to get there with some key differences. I hope that helps. I hope that helps with some of the clarity around it. I'll certainly make another video about something called the triadic model, in which cuddle therapists and psychotherapists or talk therapists work together with a client. There's quite a bit to talk about there too. If you have any questions, always put them in the comments below. I'd love to answer. And if you'd like to support, please like and follow this video. Check out any of my other videos that interest you. And I hope that you're getting your touch needs met. Have a good day.